Made that discovery while investigating the case of Melba Lowe.
In Tennessee, the Department of Health and state hospitals are not required to release information about situations where parents experience an unexpected complication, like a fall during a procedure. But we asked Mountain States Health Alliance anyway, and the health system, in an effort to be transparent, confirmed one other operating room fall at Johnson City Medical Center within the last 5 years.
We just all looked at each other. After we looked at her, our mouths was kind of fell open.
Karen Maisie and her brother Frank Huff say they'll never forget the moment they saw their mom.
One eye was swollen shut. Her nose was broken and crooked.
After what was supposed to be a routine endoscopy at Johnson City Medical Center last year.
It looked like she'd been in a bad car wreck.
Looked like somebody had beat her half to death.
It turns out the moderately sedated 89-year-old fell off her stretcher and side bed rail down for the procedure in the operating room. Mountain States Health Alliance said the woman shifted or moved at the end of her endoscopy, and despite multiple people nearby who were attentive and working appropriately, still fell. The CEO later confirmed the fall coincided with one of the people in the OR taking his or her eyes off of Melba Lowe.
When a patient comes into a hospital, there's always a risk.
In the years since that fall, Alan Levine says the health system has taken steps to make sure history doesn't repeat itself.
We want to get better. We want to be the best.
Although Mountain States wouldn't release specifics, the organization confirmed a second operating room fall occurred at Johnson City Medical Center prior to this one, sometime in the last 5 years.
We've done hundreds of thousands of procedures in the last 5 years. And yes, you had 2 situations where a patient fell. In that case or in this case, the expectation should be the same. We did the investigation, we looked at the details, we tried to learn from it, and we shared it.
Those 2 falls are 2 more than the 0 Wellmont Health System reports in the last 5 years at any of its operating rooms.
I could sit here all day and list off for you case after case where a patient came in and the doctor and the nurses performed absolute miracles for those patients. And the patients left grateful and thankful for the care they got. We want that to happen in every case. I wish it did, it doesn't.
While these siblings hope no other patient has to suffer what their mother went through,
we don't want this to happen to nobody else.
I wish we were perfect.
Levine says it's these cases that keep him up at night. He promises Mountain States will continue to strive for perfection.
We're just going to keep trying. And I have enormous confidence in our nurses and our doctors. I believe they want to do the right thing every day.
Data collected before this woman's fall showed Johnson City Medical Center performs better than most hospitals across the country when it comes to preventing all kinds of falls. That data collected from Centers for Medicare and Medicaid Services between 2013 and 2015, by the way, comes from hospitalsafetygrade.org.
Nate, thank you. Mountain States Health